As viewers know, one regular feature of our program is a sort of show and tell, where guests bring in something, some item, could be a book, could be a photograph, who knows what. We won't know until they bring it to the studio. But it's important to them in some way, symbolic of who they are and what they're about. Dr. Curtin, we'll start with you. What did you bring for us today?
Yeah, so I took a lot of time thinking about sort of what item would kind of represent or what's been like sort of with me for a long period of time. And I was looking around in my house and I actually came across this backpack, which is probably one of the oldest items I own, actually. So I've had this backpack since I was in high school. So this went through high school with me, with college, with medical school, and now it's actually kind of turned into sort of more of a travel backpack since I graduated from medical school. So, I've been to, traveling is a really important part of, something that I like to do. I've been all over the world, Japan, China, Mongolia, Thailand, Poland, Israel, Spain. I recently actually just got back from a trip to Israel as well. So, we've been all over the world together. And so I think that this sort of represents sort of my love of travel, seeing other cultures. I think we have a lot to learn, from kind of seeing, how other people live, and even within medicine, like how other countries practice medicine as well. I've had patients come to me, who have seen other practitioners. Just yesterday, I had a patient came in to me who had been treated with some Chinese herbs, and more than anything else that I had given her had actually gotten better from that. So I think that, while modern medicine has made lots of advances and has a lot of great answers, we shouldn't think that it has all the answers. And so sometimes looking out for other cultures and other sort of ways of practicing can sometimes be helpful in terms of, getting patients better overall. So that's what I brought today.
So see, that bag has seen a lot of miles over the years, I guess. Dr. Hagan?
So I brought a locket, actually. This was given to me by my mother. It's called jinyami. This is one of the idiosyncratic symbols in Ghana. These have things, they all have meanings. So jinyami pretty much means accept God. Basically you can, and it speaks to the supremacy of God and how you basically can do all things with God is what it gets at. But my faith is one of the important things that guides me through life. My family is, talk about what you do outside of here or outside of medicine and passion. And I have 2 kids and I basically chauffeur to soccer games and things like that. But in any case, it's very meaningful to me, obviously because it was given to me by my mother, but it also is one of the things that my growing up sort of let you know that no matter what you're going through, where you are, just as a guiding force. So.
We'll take one more break and be back for the last segment of today's show.
Mercy Medical Center Dr. Matilda Hagan says there is a big difference between gluten sensitivity and celiac disease, a condition that involves the immune system.
The body, specifically the immune system, recognizes, a component of wheat protein, for example, we call gliadin, as, something that it does not like. And it specifically creates what we call antibodies against that protein.
Gluten sensitivity does not involve the immune system. It's simply an intolerance and is much less serious. But patients with either condition should avoid gluten, which is a protein in wheat that helps to give the product or food its shape.
In tonight's Woman's Doctor, gastroparesis is a mysterious stomach disorder that's on the rise in teenage girls and women in their 20s. The most common symptoms are nausea, vomiting, abdominal pain, feeling full, and bloating. Mercy Medical Center Dr. Bryan Curtin says they don't have a great explanation as to why someone develops this chronic condition.
It's not something that we can necessarily fix or reverse. We can only manage it with things like diet, medications, and there are some procedures.
The average time from first experiencing symptoms until proper diagnosis, we're told, more than 2 years.
And we're back for our last segment of Medoscopy. What's changed in your field in recent years, and what's on the horizon that you're particularly excited about?
So we mentioned how, obviously incidence is rising, but more importantly, over time, the medications that are available, the treatments that we have available for inflammatory bowel disease is changing, progressing, advancing, however you want to describe that. And so that is really one of the key things, is that we have more options, or we're getting more options in terms of how we treat patients. Unfortunately, though, our existing medications don't uniformly work. And sometimes even when they work, they stop working. And then we don't always readily know which of our medicines will work best for one person versus the next. So one of the areas that's evolving is trying to figure out which pathway or which forms of inflammation in each particular person we can interfere with to kind of interrupt the disease or improve the disease.
We seem to be seeing more and more of this approach of what can we do to predict ahead of time whether somebody's going to develop a particular, sort of like that movie Minority Report. Do you ever see that one, where it's like who they predict someone's going to commit murder? So they're going to try to predict whether, John Smith here is going to develop UC or some other condition to keep it from happening in the first place. Doctor?
Yeah, I mean, I think that, in the field of motility, there's a lot of exciting advancements. I think, speaking to your point, there is a lot of work going on into determining, who has maybe genetic predisposition or sort of like autoimmune markers that are, might be more dispositive in terms of like whether or not somebody has like true irritable bowel or not. Because right now there's no like test that, proves that you have IBS, or some, or one of those disorders. There's been a lot of advancements in terms of other conditions that I think haven't been as recognized more recently, like small intestinal bacterial overgrowth, which is something that I see quite frequently. And a lot of people get dramatically better if you diagnose and treat that appropriately. Food intolerances. So, our diets have evolved a lot faster than we have, and so, our diets are rich in a lot of like big bulky sugars like fructose and fructan. And a lot of people have a lot of trouble kind of digesting those sugars, and that can lead to GI symptoms. So sometimes, making the correct diagnosis can lead to improvement in symptoms from that. But even on top of that, people who have true, IBS, where there's a new phenomenon that's been talked about more recently called the brain-gut axis. So the idea that, there can be inappropriate signals of distress sent by the gut to the brain, which can then be perceived by somebody as, bloating or pain or nausea even. And there's no objective findings on tests, but, these symptoms are real and they can be really debilitating for folks. There's a lot of research going into sort of affecting that brain-gut axis, either with medicines, sometimes with, sort of non-pharmacological options like, cognitive behavioral therapy, hypnosis, acupuncture. I know Cedars-Sinai in Los Angeles is pioneering like virtual reality to use for treatment of these kind of disorders as well, and the results there have been really promising so far. So I think there's a lot of exciting things on the horizon with regards to these conditions.
My final thoughts for you are, what do you each like about Mercy?
So I think for myself, like the culture here is really unrivaled. It's a very pleasant place to work. It's the kind of place that you walk through the halls, people are like waving, saying good morning to you, not just like on your first day of work, but on your like 500th day of work. And that has never really changed. Like, not just like the other physicians, but like top down, when we talk about nurses, we talk about medical assistants, techs, staff, everyone throughout the hospital has just a really positive disposition, really positive attitude. When I deal with challenges at work in general, like I'm always reassured by the fact that I've got a really good team around me, and so I think that the culture more than anything else is like the biggest reason why I think I like working at Mercy.
Yeah, I'd have to agree. And on top of that, one of the things that also makes it a very cool place to work is that I guess in general, the general culture is not only do you want to give like exceptional, like evidence-based care, you also want to do it in a very, compassionate way. But for in terms of thinking about your team, what I really love is, I told you before, for IBD, pathology matters, radiology matters, but I have expert consultants, which is huge. So it's not only like, yes, I want to be good in my field, but the people around you are also the best in, amongst the best in their field. And so that when you're getting care, when you're you tell your patient like, hey, I'm going to have you see a surgeon or whoever, you really feel good about the people that you're sending your patients to, because you know that they're going to get the kind of care that they probably won't get anywhere else, or as good of a care as they can get anywhere else, especially given our location and some of the surrounding areas. So I think that's one of the things. It's just not just the people and how they relate to each other, but the commitment of our colleagues also to be, very good at what they do, and also to provide the kind of care that you feel comfortable, giving your patients. So.
Drs. Hagan and Curtin, thank you both for your time and candor. I'm hoping our viewers enjoyed the chance to hear your stories, learn about some important topics, and find some ideas that they can incorporate into their own lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we meet again, may the road rise up to meet you. And congratulations, you stayed all the way through the credits for our Wait Doctor, I Forgot to Ask segment. We're back with Drs. Curtin and Hagan. What is that question that patients really should have asked but didn't, and you wish they did?
I think from my perspective, and we talked a little bit about this earlier in the segment about the stigma sort of associated with both mental health as well as also with GI conditions. I mean, I think that when we talk about, nobody really wants to talk about their bowels. I think nobody really wants to talk about their bowels in polite company. But also, people are really hesitant to talk about their bowels even with their doctors. I mean, and there's literature that's supporting this, especially for conditions that are considered really embarrassing. One of the more common conditions that I see is stool incontinence or stool leakage. And there's a lot of good evidence out there that people don't even talk about that with their gastroenterologists. So I think that the biggest question is that, there's nothing too embarrassing. Your health is the most important. Trust me, we've heard it all before. Like, if you have a bad story, trust me, we've heard 10 like that and probably 10 worse than it before. So, there's no harm in asking. There's no harm in bringing that up. And don't be embarrassed about bringing up your care to your physician.
Yeah, I would have to agree that there's really, there's no question that you shouldn't ask. I'd say that for inflammatory bowel disease, sexual dysfunction can be one thing that people should talk about, either primarily related to the disease itself or some of the therapies that we use, and that's something that most people, or they don't bring that up. They don't, they will not talk about it until it's initiated from the physician's standpoint. So,
thank you, doctors. We'll see you next time.